Hi, my name is Lacey Schooley, and today I'll be demonstrating how to irrigate a wound, collect a culture from a wound, and also how to dress a wound. So the first thing I'm going to do is look over my healthcare provider's orders. So it's from Dr. Leo for his patient Shirley Koss with a date of birth of 5/14/1964. So Dr. Leo has ordered us to do daily dressing changes of Shirley's wound with a wet to dry dressing and change it as needed. And then we need to obtain a specimen culture for the wound. So we have all our supplies gathered, so we're going to go ahead and enter Shirley's room. So we're going to knock, perform hand hygiene, close the door, and the curtains provide privacy. Hi Shirley, my name is Lacey. I'm going to be your student nurse today. Can I just have you go ahead and verify your name and date of birth for me? Shirley Koss, 5/14/1964, and that is what I have. And then do you have any allergies, Shirley, to codeine? Okay, and there's nothing with codeine today, so we are good to go ahead and start. And Shirley, how would you rate your pain right now? A 2 out of 10? Okay. So Dr. Leo has ordered us to do a dressing change and a culture on that wound. So is your pain tolerable enough to go ahead and do that? It is? Perfect. Okay, so to do this, Shirley, we're just going to turn you on your side. That way I have good access to that wound, so we can go ahead and change the dressing and do the culture, okay? Okay. So I'm going to just put this pillow next to you, that way you can lean against that instead of the railing. So we're going to go ahead and turn on 3. Okay, 1, 2, 3. Okay. Okay, so just going to turn the patient and only expose what's needed, just to give her a little more privacy. So we'll change our gloves and go ahead and get our equipment ready. So we have a dressing change tray. It's never been opened. It's not expired. We're going to go ahead and get that ready. So I have my biohazard bag to collect all the materials in today's procedure. Have a waterproof mat that we're going to put under Shirley in case anything leaks as we're irrigating the wound. And then don't eat this stuff. We're going to put our basin underneath to collect the irrigant. Okay, so we're going to go ahead and put our normal saline into this tray to soak up in the gauze. Go ahead and pour that in and let that set while we go ahead and take off this old dressing. Okay, Shirley, we're going to take off the old dressing of your wound, okay? Okay, going to go towards the wound. Okay, go ahead and throw all that in the biohazard bag. As we take it off, we're going to note the color, any drainage as we palpate around if that's coming out of the wound. There is slough in the wound, but there's no eschar. So we're going to go ahead and irrigate. So at this point, I would change my gloves since I have touched around the wound. So we are going to go ahead and begin irrigation. So with our normal saline, going to get our syringe and then our angiocath, which we would get sterilely, but for the video, it's not. So we're going to draw up 30 milliliters of normal saline into our syringe, and we're going to go ahead and irrigate the wound, holding it 2 inches above, going top to bottom, side to side. And we're going to irrigate the wound until the liquid draining out is clear. So after the 30 milliliters, it's clear, so we can go ahead and dispose of that biohazard. And we don't have to irrigate it anymore since it is clear. So clean this up and discard it in the biohazard. And now we are going to measure the wound in centimeters. So making sure not to touch it on the tape measure. So 7 centimeters by 80 centimeters. There's no tunneling in the wound, so we don't have to measure for depth. So we will document the size of it when we're done with this procedure. So the next thing we have to do is collect a culture. So we have our sterile swab here. I'm gonna go ahead and open it. take off this cap. That way after we get the sample, we can just go ahead and put it in there. So to do this, we need to make sure we're going in the granulated area and not where there's any slough, which could give us false readings. So we're going to go ahead, put that in there. You want to apply pressure to get fluid, and you also want to rotate it to make sure you get enough. So then we're going to put it back in the tube without touching the edges to contaminate it. And then if we had a patient sticker, we want to verify that it's the right patient and everything. Then you're going to put our initials, the date and time, and the location that this specimen was collected. So we're going to go ahead and put this in our biohazard bag. And our CNA has offered to take this to the lab for us while we finish up with Shirley. So she's going to do that. Now we're going to go ahead and dress the wound back up. So we've already put our normal saline into our tray here, so we are good to start. We're just going to move this. Okay, so we're going to change our gloves at this point, and we are going to get our first piece of gauze and just fluff it. And then as we're doing that, kind of drain it, because we want it damp, but we don't want it soaking wet. So we're gonna put this into the wound, making sure not to touch any of the outer skin. Okay. And then we're gonna take another piece of gauze, again, making sure it's not soaking wet, but it's damp, and put that over. And then take our ABD pad and place that over the wound with the blue line on top. And we're going to go ahead and tape it, making sure that the tape extends 1 to 2 inches past the borders of the pad. That way we know it's secure and it's not going to go anywhere. We are using the paper tape just so it's a little softer on Shirley's skin, so there's no breakdown. Perfect. And then we are also going to mark the date, time, and our initials. The way the next nurse knows when the new dressing was put on, so that way, since they have to do it daily. So we're gonna go ahead, discard this in the proper area per facility policy, take our gloves off, perform hand hygiene, and then put the patient back in a comfortable position. Okay, Shirley, we're gonna flip you over. Okay, take this pillow. Okay, Shirley, and how would you rate your pain right now after the procedure? Still a 2 out of 10? Okay, so if that gets worse, you can just call me, and I will come check on you, okay? Here's your call light. Do you need anything else before I go? No, you're good? Okay, so the patient doesn't need anything else, so at this time I would go document the tolerance of the patient during the procedure, her pain level, the color, odor, any drainage, and the size of the wound, and then come back and check on her later.